Welcome back. This is part 2 of Jeremy Hobbs' HIV Journal for Better Living. We talked on page 13A about lipodystrophy. What was it? Now we need to talk about how it can be treated. Now, because we still don't have a widely accepted case definition of lipodystrophy, we're still figuring out the causes of lipohypertrophy. We don't have universally effective treatments for it. Developing effective treatments for lipodystrophy depends on this information. There are a number of treatment approaches being looked at by researchers, none of which have yet been proven to be effective, but early results from clinical trials and by word of mouth from patients and doctors paint a promising picture. Here's a look at what's being developed and tried. And first we'll do for lipoatrophy, and then we'll do for lipohypertrophy. Lipoatrophy treatments. Switching or avoiding certain ARV therapies. As discussed earlier, two NRTIs have been strongly linked to lipoatrophy, Xerit and Retrovir. It was primarily for this reason that the Department of Health and Human Services recommends in the HIV treatment guidelines they publish against the drug's use whenever possible in people with HIV. For people who have developed lipoatrophy, switching either of these two offending drugs, studies have shown that the progression of lipoatrophy not only halts after switching, but may actually reverse somewhat. People who have not yet developed lipoatrophy should avoid taking Xerit or Retrovir to prevent the condition. Now, this is just, this is out there, plastic surgery. Surgery to restore the facial fullness and buttocks fullness has become very popular. There are two non-permanent injectable fillers approved to treat facial lipoatrophy in the United States. No fillers have been specifically approved to fill out the buttocks due to lipoatrophy through Gore-Tex implants, and are an approved treatment in the U.S. for other conditions to restore fullness to larger areas of the body that have been hollowed out. Fat substitutes, and skin thickeners injected directly into the face are being used by a number of dermatologists and plastic surgeons. Many people go to other countries where more permanent fillers are available, though people should do extensive research about the proposed treatment and the provider and the clinic they are using. Let me say this about plastic surgery. If you're considering plastic surgery to correct changes to your body fat, it is very important that you consult with a plastic surgeon or dermatologist who has experience performing plastic surgery in HIV positive people with these types of problems. Some private insurance companies have paid for these types of plastic surgery. What you need to look for is the healthcare provider conducting the procedure should contact your insurance company to confirm that the procedure is necessary for quality of life and medical purposes. And quality of life includes, your own personal well-being, how you present yourself to the public. Those all are factors in there. And another is drugs for shape changes. Glidosomes such as Actos and Avandia belong to a class of drugs called thiazolidine, whatever the hell that is. I'm not even going to try to pronounce that. They are best known for their ability to make cells more sensitive to insulin. Hence, they are approved for the treatment of diabetes. Interestingly, they have both been shown to help correct the function of fat cells. As a result, they have been studied as potential treatments for lipodystrophy, particularly lipoatrophy. There have been a handful of studies evaluating Actos and Avandia for the correction of lipoatrophy, including an Australia study completed in 2004 that failed to find any benefit in patients with lipoatrophy, though other small studies have shown at least some benefit. All right, now we're going to move on to Lypohypertrophy. Oh, that's such a tongue twister, isn't it? Of course, they recommend plastic surgery as one of the alternatives. Although there have been no clinical trials of liposuction for the treatment of lipodystrophy, numerous HIV-positive people report that it can help reduce the fat buildup in the breasts and the back of the neck. Now, generally speaking, liposuction cannot be used to remove visceral fat deeply within the body. By liposuction, there is significant risk of internal organs being punctured or damaged during the procedure. It is also important to note that liposuction to reduce fat in the breast or at the back of the neck may not be permanent. Some people see that the fat buildup return. usually several months after the procedure. Liposuction can be painful and is generally not covered by health insurance plans, although some people have had some success getting reimbursed for this expensive procedure. If you're considering, like I said, plastic surgery to correct fat changes, it's very important you consult a plastic surgeon that has performed HIV plastic surgery on plastic surgery on HIV positive people before. Another treatment is lipid lowering drugs. High levels of triglycerides and cholesterols in the blood greatly increase the risk of experiencing heart disease, a heart attack, or a stroke. These drugs are reviewed in our lesson later on called Risk to Your Heart. Drugs for body shape changes. Two drugs really that are out there. One is synthetic human growth hormone, Serostim, and the other synthetic growth hormone releasing factor, tesamorelin, have demonstrated the ability to reduce the accumulated fat at least somewhat. The company that makes Serostim failed to provide enough data for the drug to achieve approval for the HIV related to lipohypertrophy. Though the drug is approved to combat AIDS wasting, the company that makes tesamorelin, which causes a relatively similar reduction in gut fat accumulation or as Serostim, with less risk of problems with blood sugar, has also been filed for the FDA approval. A decision about tesamorelin's approval is expected next year sometime. Another one is synthetic testosterone. Manufactured versions of the sex hormone found in both men and women also have been studied as a potential treatment for lipodystrophy. Like Serostim, testosterone is an anabolic agent that may help burn excess fat. In one study, ACTG 5079, researchers compared androgel, a gel containing testosterone that is rubbed onto the skin, to placebo in 88 HIV-positive people with lipodystrophy. Unfortunately, androgel did not perform better than placebo in terms of decreasing visceral fat. In fact, visceral fat increased in both groups of patients. Patients taking testosterone also saw a reduction in the amount of fat in their limbs, the legs and arms, a potential problem for people with lipoatrophy. Another thing is diet and exercise, and this is something that we really try to stress a lot of. And it's something that you can do. It's affordable. You don't have to worry about going to your insurance or hoping your insurance doesn't. A handful of research reports have found that some patients who increased their exercise or started low-fat diets saw a reduction in their lipid levels and body shape changes. Generally speaking, lowering the amount of saturated fat, such as those found in animal products, may help reduce cholesterol levels. To reduce triglyceride levels, reducing the amount of fats and carbohydrates might be effective. Considering that everyone can benefit from more exercise and a healthy diet, all HIV-positive people, whether they have lipodystrophy or not, are encouraged to speak with a nutritionist or dietitian about steps they can take to improve their nutritional status and activity levels. And of course, you can switch therapies as well. Though no ARV drugs have demonstrated the ability to reverse lipohypertrophy, there are certainly drugs available that have much less impact on cholesterol and triglycerides. These include the NNRTIs, Viramune, and Intelins, the integrase inhibitor, Icentris, which is doing really great for people out there, and the entry inhibitor, Celzentri. Two protease inhibitors, Reataz and Prozista, are also less likely to increase cholesterol and triglycerides, but both require that their blood levels be boosted with a low dose of Norvir. Norvir does increase cholesterol and triglycerides, thus any potential benefits of these drugs may be blunted somewhat out by the what they call the dreaded Norvir. So there's just some stuff right there that you can do if you have either lipoatrophy or lipohypertrophy. And we'll talk some more later. Thanks so much for joining us.